Okay, so, I probably am being way too open, and I'm going to probably regret this, but I feel that there are some things that need to be said. People don't talk about this kind of stuff, and I am just at a point where I've had enough. As someone who you all know suffers from multiple serious chronic medical conditions, rare conditions, I, as you probably also know, have struggled a lot with getting the medical care that I need and deserve. Until you have been in the situations that I've been in, or that people, medically complex people, deal with, it doesn't sound real. It doesn't sound like these things happen, but they do, and it's not okay. I have never outwardly spoken about specific doctors, specific hospitals, specific places, other than Billings Clinic, obviously, when I was hospitalized there, but that was a whole other situation. But I'm tired of biting my tongue and letting people not be held accountable. I have tried to do everything I can to be considered a good patient. I have never abused my drugs or any drugs. I have always followed appropriate doctor's recommendations. I have gone above and beyond researching and finding ways to help my situation. That is all I do. And I am so tired of being treated like an absolute piece of garbage. So anyway, I literally just got home, I had about 6 appointments and things, that I had to do today, all of them but one to do with my health. I've been doing a little bit better, but obviously there's always roadblocks and things going on, and I have to, you know, it's just constant. Anyway, over the weekend after the wedding, I had an infection from my cortisol pump, which can happen. It, you know, it's inserted into your body, and it's a foreign thing, and I'm also on very heavy immunosuppressants, multiple ones, and to the point of basically chemotherapy, to make it simple. So very, very high risk of infection. Anyway, infections for me are deadly. I have adrenal insufficiency, so not only being immunosuppressed, I can't fight off an infection like a normal person. When you have adrenal insufficiency, if you have a major stressor on your body, the biggest one usually being infections, and infections that are not treated aggressively and appropriately, it stresses your body. Your body doesn't make cortisol, which is needed to live and to give you like the fight or flight response, and, you know, keep your blood pressure going and your pulse up and keep you alive. So my body doesn't do that. So quite literally, an infection could put me into adrenal crisis, and I could easily die. It happens all the time. This sounds very dramatic, but it is my reality, and it's what I live with every single day. So it's very important to be proactive right now with things. And so I had an infection on Sunday when I was seen in the ER. That doctor gave me IV antibiotics to get started, and then put me on antibiotic pills. I've been on them all week, and my infection's getting worse. By now, it should definitely not be worse. It should be getting better. So during my appointments today, I was seen by doctors for different things. And I did have one of the doctors look at the site and just got her opinion, like, you know, should it like look like this? Like, do you think, like, what should I do? You know, and she was very insistent that I needed to go back to the ER. I likely needed IV antibiotics. I have a history of drug-resistant infections like these twice in the past, that the pills they put me on did not work. So obviously that's probably what's happening now. And she told me I needed to go to the ER and, you know, have them probably, most likely, she thought, start IV antibiotics, or at least like different antibiotics or something, test the drainage from it, etc. So after all my appointments today, go to my favorite place in the world, Campbell County Memorial Hospital, ER. Go in, wait 2 hours to see a doctor, which is fine. It's not an emergency. I'm fine waiting. But they sent in a doctor who I have previously had multiple very, very bad experiences with. When I had COVID the first time, I was sent by a doctor to the ER because I needed, how high risk I was with COVID. Like, I needed to be assessed. He refused to listen to my lungs. He quite literally used the words, "I am not worried about you." He refused to do any of the treatments that my doctor had previously called in and ordered. So like the antibody treatments that people at high risk for COVID should get. He refused. He would not draw any labs, and he didn't even listen to my lungs, sent me home, right? So the next day, I called my doctor to let her know that, and immediately she was like, no, like, so I had to go get the labs drawn. The labs came back. They were not good. Went to the ER. I had multiple blood clots in my lungs. And had I not talked to my doctor when I did, and she did the right labs, I would have died. Pulmonary embolisms are very deadly. And so that was my first experience with him. Then a few months ago, sorry, gosh, I'm a mess. So a few months ago, the beginning of the year, December, January, I was very sick. And I was having some of the most extreme, like rib, lung pain, chest pain that I'd ever had. I've been through a lot of painful things. Honestly, some of the most painful conditions you can ever go through. And this was excruciating to the point sometimes Steven had to literally pick me up because I couldn't even stand. I was seen multiple times at the ER for this, and this doctor, I don't know, he was probably the third doctor I had seen, and they just kept telling me basically I had pleurisy, some inflammation probably around my lungs, everything was fine, I should be fine on Tylenol. Basically just treated me like a drug seeker, which I never go to the ER for pain meds or anything. You can look at my entire chart these whole 5 years. And so it was horrible, and it really affected my mental health, along with I was having side effects. We later found out from one of the medications I was on that gave me suicidal ideation. So it was a really scary time. And when you're in that much pain and that sick and no one will help you, it pretty much takes all of your will away. So I was in a real bad spot when went to the ER for this pain. He refused, quite literally told me, I'm not going to do anything for you. Even though my pain management doctors and everything were telling me to go to the ER, due to my symptoms. So anyway, it got to the point I could tell I wasn't going to be getting any medical treatment. While we were at the hospital, I wanted to go see if I could speak to one of the crisis counselors, because I was just, at that point, like I said, medication side effects, extreme pain. I was not in a good spot. So I called them to see if someone could talk to me when they discharged me from the ER, and the doctor got word of that, and he was livid. This is so hard for me to talk about, but he came in the room, basically yelled at me, like how dare I be suicidal, told me that he was going to force me to title myself, which, if you don't know, means like being titled. Basically, it's if you're like unsafe, you know, suicidal, homicidal, whatever, they would like admit you to the behavioral health unit, and basically all your rights are taken away until they like prove that you're safe and okay. He told me if I did not title myself, that he was going to call a judge and they would do it, and that they would refuse me all of my medications, which, especially at that time, like, I still have to do IV medications daily. And some of my medications are life-saving. It is not like I can just pause them. And he told me they would not be giving me any of my medications, and I could either title myself, or he was going to call a judge and they would do it legally, and then I would be stripped of all my rights. They did this. They made me undress, get into a paper gown. They were going to take all of my belongings, all of my medications. They were literally getting the process of like taking me upstairs, because I said I would do it voluntarily because I didn't want like legal issues, and I just wanted to help, and he was just yelling at me and yelling at me. Anyway, it basically came to the point that I think the behavioral health realized I have all these complex medical needs, and they can't, like the hospital here will not admit me because I'm complex. Usually I have to be like flown. I've had to be flown before out to a bigger hospital because they just don't have the specialists and things that I need here. And so I think they realized that and were like, we can't admit her. And so he came back in and told me that if I promised I would not kill myself, he was really concerned, he would let me go, and that I could speak with behavioral health the next day, which also didn't happen. They wouldn't schedule me an appointment for 2 months, even though I was suicidal, but that's another story for another day. Anyway, I have an amazing husband and family, and obviously I pulled through. But that is my history with this doctor. He should not be allowed to see me. He clearly has something against me. So today he once again came in, instantly started questioning me. Why would my doctor send me to the ER and not just order IV antibiotics themselves? I'm not the doctor. That's what they wanted me to do. It's not usually what happens. I don't know. they sent me to the ER because they thought that was the most appropriate place for me to get the care that I needed. They didn't know if I needed admitted in the hospital or if just like we'd be able to, you know, set up some IV infusions or what. Like the infection needs to be lanced and cultured so we can make sure I'm not resistant to whatever antibiotics they're using, all of that. But he wanted to hear none of it. He told me, once again, his words, "I am not concerned about you." As you can imagine, was very triggering to me. And so at that point, I had already tried like multiple times to say, then what do I do? Because the antibiotics I'm on are not working. It's getting worse. Like, I'm heavily immunosuppressed. So what do I do? Like, you know? And he would not, yeah, just sort of said he was not concerned about it. Basically that he wasn't going to do anything for me. And so then I got upset when he said he wasn't concerned, and I said, yeah, I know you're not concerned about me. You've told me that multiple times and have done this to me previous visits. And then he said, I'm done, and left. And stormed out of the room. And so at that point, I sat there for a minute. No one came in. So I left. Like, I you know, walked out, told the ER I was leaving. They asked me, you know, oh, do you have your paperwork? No. He's, you know, told me he was done. He's not gonna do anything. What am I gonna wait for paperwork for? They didn't do anything. I need to go find a doctor. So go to the walk-in clinic, and ask them if there was any way the doctors would see me for this, because I don't want to waste anyone's time, and I know it's more appropriate, I should be in the ER, but the ER won't do anything. So I need a doctor to look at this infection, and I mean, even just some different antibiotic pills or something, so I don't get this massive infection. By the way, I'm supposed to have surgery on Tuesday, but that's probably canceled now. For no reason, because doctors can't just see patients and treat them appropriately. Anyway, I spoke with the nurse. She told me I was welcome to check in, but if I needed IV antibiotics or something, they would have to defer to the ER. I said, that's fine. I really would just like a doctor to look. And so they sat me in the lobby, told me they would come get me in a minute, and someone would see me and have me sit there for a couple minutes, and then had security come. And a security guard made me leave the facility. Told me that the walk-in clinic, they must have spoken with the ER and was told that basically I don't need treatment or whatever. The ER wasn't going to treat me, so because of that I needed to leave. So once again, Campbell County Health has continued their excellence every day by berating and refusing just simple medical care. So now my husband and I are faced with, do we drive somewhere else? Once again, I don't know, you guys know like how many times I've had to do this, because I've been refused appropriate care here so many times. I try to not go to the ER here because of that. But so what do I do? All my doctors are 6 hours away. Do we drive a couple hours somewhere else to try to go to an ER? This isn't an emergency, but it's something that needs to be dealt with. I don't know. I'll have to cancel my infusion for tomorrow that I am supposed to get, so then I'll be behind on my IVIG. Probably I'm going to have to cancel my surgery now because this hasn't been handled appropriately, and won't be by Sunday when we need to go down to Colorado. And also just like want to mention how this impacts my mental health. I don't know how I'm expected to continue to fight so hard and just get help and continue to be just treated like I said, like a criminal, like a piece of garbage. I am sick largely because doctors refused to care for me when I first had issues and didn't believe me, and things went on too long multiple times in multiple scenarios. And I don't care who you are and what you've done, you don't deserve that. And when I've tried to go through all of the right avenues to advocate for myself and, you know, talk to this person or that person or report things I've reported in the past so many times, it's ridiculous. There has never been one person held accountable for anything that has ever been said or done to me, or not done. So that's not worth it. So at this point, I'm just gonna make a big old video. I am just very sad because it shouldn't be this way. I've had some really great experiences and recently, but those I can count on my hands compared to these types of experiences. I am punished because I have complex medical issues that I did not cause. I caused none of this. And I don't know. It's very hard to keep going and to keep fighting and to make 700 phone calls a week and spend my entire day from 8 a.m. until now has been at appointments. It's exhausting. And I know there are so many people out there that deal with similar situations, and it's just not okay. People don't stand up for themselves or say things because we're scared. And honestly, I am scared. I fear for the day that a true medical emergency, life and death situation happens and my luck runs out, because honestly, it's just by the grace of God, some of the things that I have survived. And one day, that's not gonna happen. I live here. I deserve medical care. And I deserve to be treated appropriately. And I am telling you, and I'm saying this on record, so that when I die, not if, when, my family has recourse. And that is horrible, but it is the truth. They will kill me. I do not have faith that I can go in with some of the potential medical emergencies that I'm very likely to have. I don't have faith that they will treat me. I don't have faith that they will try to save me. I don't know what I've done to deserve that. I don't know. I've tried to fix it. But what I have learned is that, unfortunately, the healthcare system has become very convoluted, and doctors do not want sick patients. They also don't want educated patients. They don't want patients who ask questions. They don't want patients who make suggestions or bring up issues or are involved in their care. They really don't. And I know there are good ones out there. They're far and few. And the system is so messed up that it makes it miserable for the good ones. So they don't last. I know this from both sides because obviously I've worked in healthcare. I know what it can be, and I know what it should be, and I know what it isn't. And I just feel like I've had enough. I hope that maybe, I don't really know the point of this, and maybe it'll make me feel better, I don't know, but maybe also just the others out there that are suffering and scared or losing their fight. I mean, I'm with you, and I pray that no one else has to experience this, because it's horrible. Something so simple as literally seeing a patient with a legitimate infection and treating that infection. But you would rather be mean and hateful and refuse them care. Like, I don't understand why me seeking medical care, asking a doctor or whoever who's literally getting paid to be there, that's their job, like, asking them to do that. I'm not asking for anything like wild or crazy. I don't know why that's wrong, and I don't know why I get treated like this. But once again, here I am. So anyway, I'm sorry for the hot mess. If you've watched this, it's pretty impressive because I don't really know that it's useful or helpful or anything, but I think it needs to be said, and I'm sick of, I've hinted and, you know, talked about things, but this is my life and many others' lives. Medical PTSD, I didn't even know existed. I was a nurse, you know, I'm getting my master's. I've never heard of it until I was diagnosed with it. So literally the fact that I have to experience trauma over and over and over, pretty much in some form, every single day of my life, and return to the places that have caused me some of the scariest, most upsetting, hurtful times of my life, and I have to continue frequenting those locations or dealing with those people or being treated the same way. It's hard. And I just want people to be aware. You can make the choice in your day to literally, it takes no effort to just be kind. I don't care who you are. I don't care who you're treating. It would take no more effort. It would probably take less effort to just be a decent human. But I guess some people don't have that. And I don't know how to fix it. I don't know how to fix this. I don't know what I'm gonna do. But I just felt the need to share. So here it is. Anyway, I will stop babbling and try to figure out what my next steps are. Please say some prayers that, I don't know, somehow I can get this infection under control. That it doesn't get to the point of being serious, that maybe I can still head it off somehow. And yeah, anyway, I just do appreciate all the people who do care, because I know there are people out there that do. And if you're going through this too, I'm just so sorry, because it's not right and no one deserves it. And that's what I'm gonna do tonight, is just try to remind myself that I did nothing wrong and I don't deserve this. And we'll just go from there.